I've been asked to tell you more about what actually happens in a TMS session. So, if you've been referred to a Brain Aid Clinic's clinic for TMS, then you'll know that we'll talk about the 5 steps that it takes in order to get into the chair. First step, obviously, you'd be doing at that point in time, which is inquiring. Second step is to have the psychiatrist or review essentially by a number of our specialists. The third one is to have an MRI, especially if you're having pain or one of the neuronavigated options. A fourth one is in order to come in for a calibration session. And then fifth one is to come in for treatment. So, what actually happens inside it? You might be wondering what a session involves. So, here's a straightforward look. Transcranial magnetic stimulation, or TMS, is a non invasive TGA approved treatment for major depression disorder. Regardless of the indication, it will use a magnetic pulse, an induced pulse that leads to a current being used to stimulate the activities in the brain, neural activities and regions of the brain that are relevant. Now, that's set by research studies and then applied here inside our clinic. What will happen? So you have this chair here, and you'll have a TV screen that it faces. The TV is there in order to distract you, really, but also to focus you. And the sad thing that we use it for is in order to make you guys watch stuff that you find enjoyable. Absolutely, you can choose to watch absolutely nothing. Some people watch surfing videos, something that really calms them. And that really becomes a personal preference to see how you're responding best. Once you sit comfortably inside the chair, the treatment coil, which looks like this, is positioned near your scalp. You'll feel it essentially not press against your head, but all abut your head. And you'll hear a kind of clicking sound. So it sounds like a tap or a spark almost. It depends on the intensity of the dose. And that depends on what you've done effectively with your brain. It's your brain essentially telling the machine, hey, that's enough energy in order for me to have a thumb twitch or reaction that I can see on the screen. Now, once we get the dose, we then start applying it as a treatment. And those treatments run anywhere between 20 and 40 minutes long. It depends on the protocols and what we're treating. There is no anesthetic. You're not sedated. You don't have any medication entering into your system. For most people, you won't experience a systemic side effect. So that might be that you won't have drowsiness or you won't be really fatigued or tired. But there are some people that really feel that way after treatment. Most people complain about having a headache, something local to that area, something where essentially they feel like their brain has been a little bit stressed. And that's normal. Have a Panadol, have a lie down. Keep your days light during treatment days, and we can always assess how you're going clinically. People can drive themselves home, and you carry on with your day as normal. The standard course is 5 sessions per week over 6 to 7 weeks. Now, it is possible in order to do what is considered the accelerated protocol here in our clinics. But to find out more and to see if TMS is appropriate for your situation, would ask for you to get your GP to send a referral to doctors at Brain Aid clinics. And you can email that or you can submit it on the website for an initial assessment.